All right, so this is Summer McMurry at Carolina Pediatric Therapy, and I'm here with Serena Murison, one of our awesome SLPs. Hi, Serena.
Hi, everyone.
So what we were wanting to do today is just to share with families a little bit about what a teletherapy session might look like. Some of the questions that parents have are, how are you going to get my child to engage in this therapy session when there's a screen between the two of you? So I thought the first thing we could do was just maybe talk about an activity that you're doing with toddlers, like for little ones, and then preschoolers, and then one for school-age children. And they'll see kind of what that might look like for a family.
Yes, so for my little ones who are birth to 3, those early intervention cases, I have been working really hard on making sure the session is almost entirely a parent coaching model. So it's much less about what I'm doing here in my therapy space, but more about what's happening at home. So I have been pulling up some early intervention handouts during sessions so that parents can reference back to what are we working on? We're working on modeling. And so we can get the family to pick a favorite toy or activity, and then I can coach during that activity of how to get the best language output from their child, just like we would have done in a home visit or we would have done in the clinic, versus me playing and having the child watch. Those younger children are not responding or would not likely respond to just a figure on the screen, but with a parent interacting, that's the most success, is if we can see the family working on those skills. We can say, oh, this is a great opportunity to practice that. This is a great opportunity to imitate. Let's practice. He just said pop. Let's do it again. Let's get more pop.
So you're doing a lot of coaching in that for little ones right there. So the parent is really guiding, and you're kind of whispering in their ear about just, okay, that's the next step.
We're the earpiece. We're the little earpiece.
Yeah, that's great. When you had told me a little bit about how you're prepping families before the session, if you have little ones, to make sure that you're picking activities that the child is interested in that are going to be really engaging to them. Can you tell me about that?
Yes, so before sessions with families who are in those early intervention years, I've been calling the families to ask if there's any activity that they really feel their child is most interested in at home. For some of my kids, it's cars. For some, it's water play or bubbles. If they have any of those materials at their house, I'll say, let's grab those for the session. Let's plan on using bubbles and cars today. So mom will, when we pull up the call, mom already has bubbles and cars handy. And we've already discussed that we're going to be practicing doing 1, 2, 3, go. We're going to be doing that verbal routine multiple times for about 20 minutes or so. We're going to be doing bubbles. If he loses interest, we're going to move on to the cars. That way we have kind of a lesson plan in place before the session so that mom and I are both on the same page. And it's not me saying, oh, can you go find some bubbles, by the way? So we're ready.
Great. That's great. That sounds good. And that sounds really like it lines up with the early intervention model that we would do when we were going to someone's home anyway. We would probably not take our toy bag into the home. We would typically use the toys that they had in their home, and then we would coach the parents. That's our interaction that happens every day anyway.
Yep.
Yeah, awesome. Well, how about for preschoolers then? Well, hold on. Before we go to preschoolers, you had a really cool thing that you showed me with your camera where you get the little ones to see Mr. Potato Head or a toy that they were playing with.
Yes, so I'm going to right now share my screen with my iPad. We're actually not going to be using an app on the iPad right now. We're going to use my camera. And I have made a little situation here. I guess you could call it a docu-scan. What is it called? I don't know. A way that I can show my physical materials that are familiar to my families and kids. Mm-hmm. Without having to use an app or even use a website. So a lot of my children that I like to play with, I love to play with Potato Head. I mean, he is so versatile. So I love Mr. Potato Head. He is the one, you guys. He is the most versatile toy for our little ones. They're familiar with him, and I've played so many times with Mr. Potato Head in sessions that I will lay out all of his pieces. And that way the child can still see my face. We're still playing together, but I'm not having to hold up every piece where the child feels disconnected and can't see all of it at once. Right. We can see it all together. So I've been doing activities like, what does Mr. Potato Head put on his head? Does he put shoes on his head?
No. No.
No. Does he put ears on his head? No. What does he put on his head? So we can really interact, and they love to watch me make those mistakes and correct me so we can construct him. You can do a lot with this docu-cam. You can do all of your familiar toys.
Right.
And lay them out.
That's great. And so that's just on you're just projecting you're looking through your camera onto the floor where you have the toys, and you're just projecting that onto the screen so that the child and the family can see what you're doing, and they can do the same thing at home.
Exactly. And sometimes if a parent also has the same toy, they can lay it out, and they can be watching how I would do it and put the same pieces out, so that way the family can learn that skill too and do it at home. Versus just giving him the potato or giving the child the potato head, they can learn how we would practice playing with potato head and sort of practice in the same exact way that I was doing it. And then when I leave, they can do that same activity again.
That's great. I love that. I love that you've been very innovative in using your camera to really show the child the toys, and that way they can see them.
Yes.
Versus just holding them up on the screen. That's really nice.
Yeah, exactly.
Okay, so how about for your school age kids now? Or for your preschool kids? Let's go to preschool children.
So
what do you do with those?
Kids, we have been playing with the docu-scam, but we also have been playing with some really fun apps. For instance,
welcome to You're the Storyteller, the surprise.
This is a fantastic app. I have used it multiple times in the last 2 weeks. It is a storytelling app where children can watch a clip of a cartoon. We watch it together, and then we learn how to retell the story. This can target, sorry, I'm being interrupted by the puppy. This can target so many different skills. We can target inferencing. We can target past tense verbs, who, what, where questions. And the best part is we can do it over and over again, because this is a very motivating task. Seeing the cartoon is motivating in itself. I've had really good success with this. And at the end, we get to watch our story with our own narration. So I can do some narrating and the child can do some narrating. We can take turns, and at the end, it creates a little video clip where the child's voice is narrating the story, and they just get a kick out of it.
That is a great activity.
I love it.
What is this app called?
It's called The Surprise. And parents can also get this on their phone or iPad. One thing I have done for the families who might not want to buy this, it is a few dollars. I have taken screenshots of the app following our session and sent them to parents so that maybe they could go over it with their child again and recount what they did in therapy. So, oh, right, we took, you can take a little screenshot right there.
Okay.
And I send that to mom or dad over text message, and they can show the photo to their child later. It might not be as
in between
fun.
Sessions. Yeah.
Exactly.
Yeah, that's really great. So that's for your preschoolers. And do you have other activities you really enjoyed this week with your school age children?
Well, I mean, I honestly don't have a very big school age group, but I have worked on some complex verbs with my older kids and some reading and writing skills using boom cards.
Okay.
Boom cards are absolutely awesome. They are new to me. As you can see, I've downloaded a million boom cards.
Yeah.
I've gone a little bit wild with the boom cards, but for my older kids, we've been playing games like this, like, let's listen to this sentence. The girl waved goodbye to her friend. Was that a past tense, a present tense, or a future tense? So we've been talking about verb tenses, and then I give the child remote access. They can click. Let's say the child clicks on present tense, it'll say whoops, and then they can click again and get that ding sound and can keep going through
that feedback. Yeah.
What's pretty cool about this is that they get to have remote access and actually interact with the screen. And just that alone has been motivating. And even though, and I think in person, these activities would be maybe not as interesting, but the fact that they're able to click on something we're both seeing has kept a lot of my school age kids interested.
That is awesome. So, okay, Serena, so as far as parents who are just newly getting introduced into the teletherapy world, as we're all staying home and staying safe with COVID, what is the one tip that you could give to a parent to kind of help them and their child to have a really successful teletherapy session?
This is genuinely what I've been saying. This is new for everybody. Right now, this is the big quote you keep seeing going around is, we're not just working from home, we're working at home during a crisis. All of us are going through COVID together. We also still need to work on our therapy skills. Those skills don't maintain if we don't have weekly sessions. And thankfully, we're able to do this. We have a shot at not regressing. So even though it might not be comfortable and it might not even be at the beginning so easy, it might be a little bit different learning that new coaching model, staying with your child and engaging them when I'm not able to reach through the screen. There are some learning curves, but once we get there, it will replace in-person therapy as long as we need it to. And that is worth it. We're going to just try. That's my spiel. We're just going to try. And if it really doesn't fit, we'll talk about the options after that. But right now, I just want to give it a shot for a few weeks. Let's see how it goes. And I think after that, we're all on board, because this is our one big shot at not regressing in our therapy skills and our language and communication skills.
Yes. Well, and I think that that's been the common theme as I've talked to several of our therapists as we've been doing this, is that the more that they do it, the more parents get engaged with it. It's uncomfortable for everyone in the beginning because it's just something new and we're all learning something new together, but we're in it together. And that's one thing that we can all feel really good about, is we're in this together, and we're going to continue to serve our kids and to help our parents to really be successful with this. And it will get easier as we continue to get more automatic with it and learn the tools that we need to use.
And really, it can be just as good. It can be just as awesome. There are sessions that I've had in the last week where I was like, I feel like that was just like we were together. And when you start having those moments, you realize, okay, it's worth it. We're going to keep doing it. There might be awkward moments, but it's worth it. And we're going to get our therapy in. So I'm hoping that we can get all of our clients on board and getting everybody trying out telehealth.
Yes. Well, thank you so much for sharing. I think this will be really helpful for our families as they're just curious if they've not gotten into the teletherapy yet. And it seems like that, when we thought this was going to be just a couple of weeks, some families were like, well, it's just a couple of weeks. I'll do back in person again in a few weeks. But now that it seems like this is going to be kind of how we're doing things for a little while until COVID passes on and we're all able to be back together again, it seems like this is a really great way to continue to access care and to provide support for our families and their kids while they're at home.
I agree.
Yeah. Well, thank you, Serena. Thanks for sharing.
Thank you.